I'm David Brown, Director of the Virginia Department of Health Professions. Welcome to Virginia's core competency modules for pain management and addiction. These competencies were developed by work groups convened by Virginia's Secretary of Health. Over 24 experts in pain management and addiction compiled the essential competencies that Virginia's health professional students must acquire, not just our future physicians, nurses, dentists, and pharmacists, but the wide range of professionals who work with these types of patients. These modules, made possible by a Department of Behavioral Health and Developmental Services grant, present key parts of the competencies for use not only by our schools, but by practitioners already in the field. Thank you for your careful attention to this important information.
This module is called Introduction to Addiction, and I'm Lisa Arcan, and I'm the Associate Professor of Psychiatry and Behavioral Science at Eastern Virginia Medical School, where I direct the medical school addiction curriculum, and I'm Assistant Clerkship Director. And the second topic is definition of addiction as a chronic disease. In this topic two, we have 3 learning objectives. The learner will be able to define addiction as a chronic disease, and the participant will be able to assess the DSM-5 definition of substance use disorder, including the classification system for diagnosis. The learner will be able to describe this ASAM, the American Society of Addiction Medicine's 6 dimensions and levels of treatment, and the clinical and behavioral elements of addiction. Addiction is defined as obsessive thinking and compulsive need for drugs, alcohol, food, sex, or anything despite negative consequences. It includes the development of tolerance combined with withdrawal symptoms. There will be an intense physical cravings and emotional obsession to take the substance regardless of the consequences. Addiction develops over time and usually begins with misuse, moving towards abuse, and resulting in addiction. The National Institute of Drug Abuse, NIDA, defines addiction as a chronic relapsing brain disease that is characterized by drug seeking and use despite harmful consequences. The DSM-5 is the American Psychiatric Association gold standard text that names symptoms and diagnostic features of every recognized mental illness, including substance use disorder. The DSM-5 recognizes substance-related disorders resulting from the use of 10 separate classes of drugs: alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, tobacco, and other or unknown substances. Substance use disorders are patterns of symptoms resulting from the use of substance that a person continues to take despite experiencing problems as a result. Substance abuse disorders, including intoxication, withdrawal, and other substance medication-induced mental disorders, are recognized alongside substance abuse in the DSM-5. The DSM-5 defines substance disorder with 3 subclassifications: mild, moderate, and severe. Mild is defined as having 2 or 3 of the symptoms present. Moderate is defined as having 4 or 5 of the symptoms present, and severe is defined as having 6 or more of the symptoms. The symptoms associated with substance use disorder fall into 4 major groups: impaired control, social impairment, risky use, and pharmacological criteria, such as tolerance and withdrawal. DSM-5 describes a problematic pattern of use of an intoxicating substance leading to the chronically significant impairment of distress, with 10 or 11 diagnostic criteria, depending on the substance, occurring within a 12-month period. Addiction is a specific chronic mental health disorder resulting in defined symptoms and behaviors that can be used to diagnose the condition. The signs and symptoms of substance abuse disorder and addiction include using more of the substance than the person originally planned, being unable to stop using the substance, experiencing relationship problems based on substance use, spending large amounts of time seeking or using the substance or recovering from the use, reducing participation in favorite activities in favor of substance use, being unable to keep up with daily responsibilities due to substance use, craving the substance, continuing to use the substance despite negative health issues, regularly using the substance in dangerous situations while driving or operating machinery or things like that. Developing tolerance of substance as described above, experience withdrawal symptoms when using is stopped. As I discussed before, in general, experiencing 2 or 3 of these symptoms is considered a mild substance use disorder. Reporting 4 to 5 of these symptoms is a moderate disorder, and if the person has experienced 6 or more of the symptoms, it's considered a severe substance use disorder or addiction. The American Society of Addiction Medicine definition of addiction is a primary chronic disease of brain and reward motivation, memory, and related circuitry. Dysfunction in these circuits leads to a characteristic biological, psychological, social, and spiritual manifestations that is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by the inability to consistently abstain. This is the A, B, C, D, E. So abstain is the A. The B is behavioral, impairment in behavioral control. C is craving. The D is diminished recognition of significant problems of one's behaviors and interpersonal relationships. And E is emotion, dysfunctional emotion response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can lead to disability or premature death. ASAM has 6 dimensions: acute intoxication or withdrawal potential, exploring the past and current experiences of substance abuse and withdrawal. Biomedical conditions and complications, exploring health history and current physical conditions. Emotional and behavioral and cognitive conditions and complications, exploring thoughts, emotions, and mental health issues. Readiness for change, exploring readiness and interest in changing. Relapse, continued use or continued problem potential, exploring the unique relationships with relapse and continued use and problems. Recovery and living environment, exploring recovery and living situations and the surrounding people, places, and things. ASAM describes treatment in a continuum marked by 4 broad levels of service and early intervention level. Within the 5 broad levels of care, decimal points are used to further express graduated or intensity of services. The levels of care provide a standard to describe the continuum of recovery-oriented addiction services. They describe treatment on a continuum marked by 4 broad levels of service in the early intervention level within the 5 levels. These are the ASAM levels of treatment. They have 4 main levels of care. Number 1 is outpatient services, office-based treatment in primary care or outpatient addiction medicine settings, appropriate for patients who are not at risk for complications, withdrawal, or have medical, psychiatric, and housing stability, and who are motivated for treatment. Level 2 is the IOP, intensive outpatient programs, or partial hospitalizations, and they offer more intensive treatments and medical management. The partial hospital programs, also called PHP, is generally 20 hours a week, appropriate for patients who have failed outpatient treatment, stepping down from a residential treatment, or who have medication, psychiatric complications, and factors making them very high risk for relapse. Level 3 is residential or inpatient services, 24-hour care. It ranges from peer-supervised, drug-free housing, sober living environments, to clinically managing inpatient rehabilitation services, appropriate for patients who have medical, psychiatric, neurological complications, and a high level of commitment for abstinence. And finally, level 4 is medically managed inpatient services, that most commonly used for patients who are at risk for complications from withdrawal, and often done in a detox unit or a treatment center or in a hospital. Through this strength-based, multidimensional assessment, the ASAM criteria addresses the patient's needs, the obstacles and liabilities, as well as the patient's strengths, assets, resources, and support structure. Both the DSM-5 and ASAM recognize addictive behaviors, also called impulse control disorders, as treatable forms of addiction. They are associated with the pathological pursuit of rewards. This includes gambling, food addiction, sexual addiction, internet addiction, shopping addiction, exercise addiction, and video game addiction. The common characteristics between behavioral addiction and substance use addiction is obsessive preoccupation with an activity, object, or substance. They'll go to great lengths to avoid feeling the discomfort as a result of withdrawal from the substance, removing the objects, or cessation of the activity. They're unable to control their own behavior and unable to refrain from their addictive behaviors, even though they want to, and deny the presence of any difficulties as a result of their behaviors. They continue to engage in the behavior and use substances even though it results in continued accumulation of problems and negative outcomes. Any activity that has become the primary focus of an individual's daily life, in exclusion of other activities that begin to consume the person, can be considered an addiction. More information on this criteria can be found at the NIDA or APA or ASAM websites. Topic 3 is addiction in primary care, and Dr. Stephanie Peglow from EVMS will be talking to you about that. Thank you.